Hi, I'm Hadiza Muhammad.
February 27, 2021
will make it 1 year since the first COVID-19 case was announced in Nigeria. Since then, the country has seen thousands of cases and is currently going through the second wave of the pandemic. Globally, conversations have moved towards issues such as the cost and availability of vaccines, vaccine nationalism, safety concerns, and conspiracy theories. How has Nigeria fared over the past year in dealing with the pandemic, and where are there still gaps? Nigeria Health Watch took to Abuja streets to find out what residents of the capital feel about the government's efforts 1 year later. Here is what we learned.
The awareness is not even enough. It's not there. A lot of people go about without this face mask. If you want to go for the COVID test now, it's 40,000. So if you have COVID or you have the symptoms, where do you get for? What if you don't have 40,000? One way you don't even have 5,000 to feed. How do you get 40,000 for a test? The government is not doing enough at all.
Federal government did so well by continue paying the salaries, doing some other projects, and bringing in the kind of kits for COVID-19 protocol and so on. The campaign, the awareness and so on is truly remarkable.
The testing of COVID-19 have not spread to the rural areas as supposed to be.
I would say that so far the government have tried to do their best, especially via isolation centers and sensitizing the masses. And most times we might not actually adhere properly to it, but they have created the awareness there.
The only thing I think they've managed to do well, it's the awareness creation about the COVID-19. But anything other than that, to be honest with you, I don't think they've really done anything well regarding that. And the other thing they ended up doing is how they were able to upgrade some of the hospitals that can accommodate them, the elite at the top. But for the common man, nothing.
Lots of things would have been done better. Rapid testing, more isolation centers, more response from whoever is calling,
They should create more awareness, even down to rural areas, because there are places you travel to, they don't even believe that there's COVID-19. And people from the urban area traveled there, and you don't know their health status.
Certainly, some interesting reactions there. To provide insight into what the last 1 year has meant for Nigeria, here is Nigeria Health Watch Director of Policy and Advocacy, Dr. Ifeanyi Nsufo.
So it was quite interesting watching, the Vox Pop by Nigeria Health Watch, going out, talking to Nigerians to unpack their, perceptions and experiences with our response to COVID-19 so far in this country. So to be honest, there can never be enough awareness because people are at different levels of understanding as far as public health information is concerned. The government has done well, especially at the federal level, through the Nigeria Center for Disease Control. But I think where the gaps lie is actually awareness as far as states and local councils are concerned. Because what we find is that most states and local councils are still waiting for the federal government to take the lead in awareness for COVID-19 and other infectious diseases in the country. And that is wrong because this is actually the bedrock of primary health care, which lies within the purview of local councils supported by the state. So a lot more needs to be done in that area by the state and local councils. And I also think that Nigeria being a deeply religious country, it is important that we begin to engage religious leaders as spokespersons. So going forward, I don't want to see people like me talking about advocacy for public health. I want to hear religious leaders be the ones. If you look at the information from Nigeria Center for Disease Control, there are about 78 public laboratories across the country, 40 private and 7 corporate. And in all the public labs, COVID-19 tests is free. And again, it brings us back to the awareness. We need to put out this information, as consistently as possible so that people realize that you could go to a public lab. You don't have to go to a private lab to do your COVID-19 testing. Somebody spoke about the fact that treatment, they had done treatment, isolation centers for rich people and things like that. I think that information is also incomplete because first of all, the data is that at least 80% of people who are positive for COVID-19 are asymptomatic. They don't have symptoms, so which means that they don't even need to be in the hospitals for treatment. And so that's on one hand. On the other hand, I also think that if you look at how Nigeria has approached treatment of people with COVID-19 in the country, you find out that there's community management of COVID-19. And what that means is that for those people that are not so sick that they require hospitalization, they are managed conservatively at home, supported by their family and friends. And I like that bit, because I think that's a lesson that other countries need to learn from Nigeria's handling of the pandemic, as well as treating people. There's this mantra by the University of Global Health Equity that I totally agree with, that for us to achieve equity in healthcare, we must achieve equity in health education. So we have to keep putting out information. We can never get tired, because there's somebody somewhere that has never heard about what it is we're talking about. There are people that have heard and not yet convinced. And ultimately, we just have to keep putting out information and hoping that gradually people will begin to change behaviors for good.
That's all for today. Thank you for watching. Remember to continue taking responsibility to protect yourself and others.